Welcome back to Living Passionately with Pat Brown. Today, I am so elated to have my new cousin-in-law, Dr. Kelly Wood, join us on Living Passionately. Kelly is a board certified internal medicine physician. She is certified in endocrinology
Yep.
and diabetes and metabolism. We got to talk some more about that, of course. Kelly earned her medical degree from the University of the West Indies in Barbados before relocating to the US in 2006 to pursue her internship and residency at Pennsylvania Hospital. From there, Dr. Wood went on to complete an endocrinology fellowship at the University of Wisconsin Hospital and Clinics in Madison. Dr. Kelly is now in clinical practice in Atlanta, Georgia, and through a multidimensional platform, she addresses the mind, body, and spirit, which I love. Thank you, Kelly. And her passion is to help others achieve total wellness and lead a balanced life. She has held various teaching positions in associations with medical institutions around the US, and she makes expert health and wellness advice accessible to all through speaking engagements, media appearances, and personal blog. Dr. Kelly maintains connection with professional organizations such as the Endocrine Society and the American Association of Clinical Endocrinologists. So here we go. Thank you again so much. I love that you're into wellness and you'll be my new friend. Of course, in addition to being my cousin-in-law, because I'm all about wellness and I'm on that journey. So I need all the help I can get. So I live in passionately. I love to encourage people to live their best life. And so today I want to address the issue of diabetes, which has really, I don't want to say taken over, but has become very prevalent in our society. There are lots of young people. Only 2 years ago, I heard my niece saying that her daughter, who was about 10 at the time, was pre-diabetes, and that was very, very concerning. So
Mhm.
I'm going to let you get started. Tell us a little bit about your practice, where you got into endocrinology medicine, and share with us.
So, like you mentioned, I'm in clinical practice in Atlanta, Georgia, in endocrinology. The majority of my practice is diabetes, mainly type 2 diabetes. I do see some patients with type 1 diabetes.
Okay.
Why did I go into endocrinology? My grandfather in Barbados, he had diabetes as well. And I remember when he was probably in his late 70s, he had issues with low blood sugars.
Okay.
And my mom and I struggled with that for a little bit in terms of getting him stabilized. So because of that, my interest, was shifted towards diabetes. And like, there's lots of diabetes in Barbados as well.
Yes, a bit too much. Yes,
Mhm.
yes. Do you think that part of it is education? Do you think that it's from genes and things like that? Like, why do you think it is so prevalent?
So type 2 diabetes basically is a lifestyle disease. People do have risk factors of genetic predisposition, meaning that, if both of your parents have diabetes, you have like a 1 in 2 chance of developing diabetes yourself. But
Okay.
then there's also a lifestyle component to it, meaning that not everyone who has that family history goes on to have diabetes. People who are sedentary, who are overweight or obese, and unfortunately, a lot of the population nowadays do have obesity or overweight, and then we don't really stick to a healthy diet. A lot of those things contribute to why the population as a whole, more and more people are being diagnosed with type 2 diabetes and at a younger age as well.
Okay. What is the difference between type 1 and type 2 diabetes?
So, type 1 diabetes is an autoimmune illness. And what that means is that our immune system normally protects us by making antibodies to fight like viruses and bacteria and other infections. But in autoimmune disorders, the immune system actually attacks our own body. And in type 1 diabetes, the immune system attacks the pancreas and causes the pancreas not to make insulin. And that's why blood sugars go up. Type 1 diabetes typically happens in children, teenagers, adolescents, young adults,
Okay.
as opposed to type 2 diabetes, which typically happens in people over the age of 45. But because younger children are also now obese and overweight, it's happening younger. But in type 2 diabetes, like I said, some people have that family history, but also being overweight, being obese, not being very active. And in type 2 diabetes, the pancreas makes insulin just fine, but because of the extra weight, it doesn't work as well. So that also leads to the high blood sugars. So insulin resistance is the hallmark of type 2 diabetes.
Okay, so I hear a lot that word quite a bit, like insulin resistant. Like, what exactly does that mean?
So, insulin is a hormone,
Mm-hmm.
and the purpose of insulin is to get sugar or glucose from the
Okay.
bloodstream into the cells where it's
Mhm.
needed for energy. You can think of insulin as the key that unlocks the cell for the glucose to go into.
Okay.
So when someone is insulin resistant, there's lots
Mhm.
of insulin around in the bloodstream, but the key doesn't work anymore.
Oh, I like how you broke that down. You're a teacher, huh? Awesome, because that's really great. I like how you broke that down because we definitely need an education and to understand.
Mhm,
For myself too, because it scares me. There's a lot of diabetes in my family also, and I'm already dealing with high blood pressure, which I'm trying to get rid of. I struggle with that. It goes up and down. I
mhm,
have my
mhm,
medications reduced at times, but life happens, and I don't
mhm,
like to make excuses. But so I'm challenged with keeping my blood pressure under
mhm,
control.
mhm,
But the diabetes really, really scares me because I've seen the result of what can happen to people that do have that type 2 diabetes. And you said earlier something about the genes that if you're predisposed, if both parents have diabetes, that there
type
is
2. Yeah.
type 2, that there's a chance of you also, like a 50% chance, you said,
Mhm.
also getting type 2. So that is, I guess, statistics, huh? Scares.
Yeah, yeah. There's no one like gene that
Mhm.
causes type 2 diabetes. There are a whole host of genes that have been linked to type developing of type 2 diabetes. So you
Okay.
have that genes, but then you also have environmental factors. So you can't control who your parents are, right? You can't control how old you are. Like I said, it happens above the age of 45. So those are risk factors that what we call non-modifiable. We can't change them. But there are
Okay.
other things that you can do to reduce the risk of developing diabetes or prediabetes.
Talk about those things.
Right.
Yeah.
So one of them is maintaining a healthy weight. So one of the
Okay.
biggest risk factors is being overweight or obese.
Mhm.
Two is exercise. Recommended amount of exercise is a minimum of 150 minutes per week. We can talk about that a little bit more.
Okay.
But that's like half an hour, 5 days a week. Having high blood pressure, high cholesterol, those are also risk factors for having diabetes.
Okay.
Having gestational diabetes, meaning diabetes while you were pregnant,
Yes.
that's also a risk factor as well. Having babies, big babies over 9 to 10 pounds, that's the risk factor for having diabetes.
I know a couple people that had the gas station diabetes. And one of my friends, I mean, her weight is like, say it's college, she probably gained 5 pounds. So she's like maybe 110,
Yeah.
maintains her weight, but she ended up with gestational diabetes. How does that happen?
So a lot of things going to gestational diabetes, the placenta actually makes a hormone that raises blood sugars. So you don't always have to be for in pregnancy, you don't
Mhm.
always have to be overweight to develop gestational diabetes.
Okay.
Sometimes it's due to the placenta.
Okay. Well, sounds like so much goes into yes, diabetes. Thank you so much. I greatly appreciate the education. So you were saying things like controlling your weight, diet, and environmental. What are some of the environmental factors that we should look out for? Like we can control our weight, we can exercise, we can diet, but what about the environmental part of it?
One thing you can also modify environmentally would be like your stress levels. Stress will definitely,
Yeah.
so there's a hormone called cortisol.
Mhm.
That's our stress hormone or flight or fight hormones. And cortisol raises blood sugar levels as well. I would say main things would be monitoring, where you're getting your foods from.
Mhm.
A lot of things that they add to our foods increase our weight, also predispose you to developing diabetes.
Yeah, and that's a big issue right now. The things that, the food is being developed in such mass quantities. The
Hmm, hmm.
quality of our foods have really gone down. Do you think, or would you say that we should eat more natural foods, like things from the ground, the things that we grew up with, like the potatoes and the vegetables? Do you think eating like meat contributes to it or doesn't, or for what you've seen in your studies?
Things that we grew up with, like this, we were talking about like sweet potatoes and cassava.
Mhm.
Those kind of things are starchy vegetables. So
Okay.
are eventually broken down into sugars. So you still have to be mindful of the amount of those things that you eat. I always tell my patients there's no like one perfect diet for diabetes. There are a
Mhm.
few that have been shown to be of benefit, like the Mediterranean diet, which would
Okay.
be, like non-starchy vegetables,
Mhm.
healthy fats, lots of, fruit and healthy fruit and vegetables. Some people also do like a lower carb diet. There's some people who try to cut out all carbs together and go on the keto diet. Your brain still needs carbohydrates and sugar for energy. If you can do the keto diet and maintain that, great. But
Mhm.
while a lot of people go on these like crash diets, lose a lot of weight and then regain it and more. So
Right.
what I say is stick to a diet that you're able to maintain for long term.
That makes sense. Yeah. Yeah. I've tried a keto also. I like the Mediterranean diet too, but I think that is something that I need to work on more
Mhm.
is a Mediterranean diet.
A simple thing is what I like is called the plate method. If you think about a plate, half of your plate should be a non-starchy vegetable, like I don't know, broccoli or cauliflower, kale, or something like that, right? And then a quarter of your plate could be a starch, like the sweet potato or the cassava or the rice. And the other quarter of that plate should be your lean, healthy meats. Vegan and vegetarian diets have also been shown to be helpful in terms of lowering blood sugars in patients with diabetes, but you don't have to do that to manage your diabetes.
Okay, I'm making some notes for myself here as we speak, but I'll have the video to go back to, but these are some really, really great pointers. So thank you so
Mhm.
much. What would you say that would be like the best way to monitor your blood sugars at home?
So there are a few ways, and technology has really improved over the last decade. So
Yeah.
we all know about the finger sticks, where you have like the blood sugar glucometer. You
Oh,
stick your
yeah.
finger, get some blood, you put it on the strip, put it in. That's still one of the best ways to monitor your blood sugars. But
Okay.
now we have something called continuous glucose monitors. You might have
Okay.
seen commercials on television for a Dexcom. You might not, but they actually had a pretty good Super Bowl ad earlier this year
Oh,
for a
really?
Dexcom, something else called a Freestyle Libre. Those are little sensors that go on the back of the arm
Oh,
or are in the
extra.
tummy, in the skin. You might have seen people walking around with a little white disc on the back of their arm.
Mm-hmm.
And those devices continuously measure your blood sugars like every couple of minutes. And you can scan over it, or sometimes you can even see it on your phone and see
Oh,
what
wow.
your blood sugar is doing.
That's really great. Yeah, think about, yeah, technology is always improving, so we have no excuses
Mm-mm.
not to monitor our blood sugar levels. And that is something that you would recommend that people do on a daily basis.
It depends on the type of diabetes you have,
Mhm.
one, also what your medication is like. If
Okay.
you're taking multiple shots of insulin per day, then you
Mhm.
should be checking your blood sugars multiple times a day.
Uh,
Someone who's just on, say, one diabetes tablet, your doctor might only want you to check it once a day or a few times a week. So
okay.
speak to your physician to
Mhm.
see how often you should be checking your blood sugar. But I
Okay.
do feel that people who test their blood sugars do better because
Mhm.
they know what's happening with their bodies. They're not living in denial about having diabetes. They
Right.
know the foods that they eat. They can see how it affects their blood sugars. They can see how their mood, how stress levels, how lack of sleep, how all of that affects their blood sugars. And if they're ill or going through any other, medical issues, they can see how their blood sugars are affected as well. And that can help their doctors change their medication if needed.
So you said lack of sleep can also affect your blood sugars.
Yeah, lack of sleep will raise those cortisol levels that we talked about earlier, those stress hormone levels, and
Mhm.
can do a lot of things. It can raise your blood sugars, it can raise your blood pressure, it can cause it have more difficulty losing weight as well. So sleep is one of those pillars of health that we don't talk about enough or we forget sometimes.
Yeah.
But just like with exercise and diet, we have to have good sleep.
Yeah, one of my brothers, Wayne, he goes to bed by 9 o'clock. And if you call him at 9:01, he'll
Can't
answer.
reach him.
No, he might answer, but he'll ask you, what is the emergency? Because it must be an emergency. And he's been that way for, I'll say, at least his Katisha is like probably like almost over 20 years.
That's a good habit.
I don't know how he does it. I am far from there, but I am working on my wellness. I want to live passionately. So I have some things to work on. All of this is such an eye opener. What type of advice would you give someone that is newly diagnosed with diabetes? Because
A new diagnosis of diabetes.
I said that could be scary.
Yeah, it's pretty overwhelming sometimes, especially a lot of people when they first get diagnosed, a lot of people, their blood sugars are really high and they end up in the emergency room.
Mhm,
So, as you said, it could be extremely scary. I would say one is not a death sentence. You can manage diabetes with the help of your physicians.
mhm,
I would say make sure that you seek help. A lot of patients have symptoms of diabetes that they ignore for a long time before it gets to that point where they have to go to the emergency room. So I would say seek help. A lot of primary care doctors can manage diabetes pretty well, but if you find that your blood sugars aren't coming down with seeing your primary care doctors, ask to see an endocrinologist. I also like referring my patients with a new diagnosis to see a certified diabetes educator. A lot
uh-huh,
of these folks are also registered dietitians and nutritionists
uh-huh.
because that diet component is going to be key in managing your blood sugars.
Okay, that makes sense. Okay, awesome. That's really great advice. And then going back to the exercise recommendation that you said, like getting that 150 minutes per week.
Yeah, that's not only for patients with diabetes, that's for everybody.
Yeah. Yeah.
Everybody who's living.
Buddy.
Who once you're able, you should get in 150 minutes per week. That's like half an hour, 5 days a week
Mhm.
of aerobic exercise, something that really gets your heart pumping. If you're not a runner, don't go out there and start running. Like do something that you're able to do, that you enjoy doing.
Right.
Could be a nice walk, could
Hmm.
be swimming, could be stationary bike, could be dancing, could be whatever you are capable of doing that
Hmm.
you can sustain. And then adding about at least 2 days of resistance training as well.
Okay.
Both the cardio and the resistance training have been shown to help reduce blood sugars. One little trick that I give my patients is to go for a walk, do some kind of exercise after a meal because blood
Okay.
sugars will go up after you eat, and exercising after the meal will help to bring those down.
Okay. Thank you so
I,
much, Dr. Wood. I feel like I've learned quite a bit here today. So,
good. And you
yeah.
don't have to do the full 30 minutes at once. If you're not
Mhm.
able to do it, you can break it up in two 15-minute periods or three
Right.
10-minute periods just to make sure that you get in the 30 minutes for the full day.
Right, that makes sense. Yeah, thank you. And what are some of the symptoms that we should look for? It's scary to get that diagnosis, right? And you might start doing things or seeing things that are happening that could be pointing us in a direction that maybe you might have diabetes or pre-diabetic. What are some of the symptoms that we or signs that we can look for?
So most people with prediabetes don't have any symptoms at all. So what is prediabetes? Prediabetes, your blood sugars are higher than normal, but
Okay,
not high enough to be classified as diabetes.
right.
Prediabetes can be thought about as a precursor to diabetes.
Okay.
Some people with diabetes don't have symptoms either. They find out when they go to their doctor. So
Hmm.
don't skip your annual visits to your physicians.
Right, right.
Make sure if even if you're feeling well, still go once a year because most of them will do the screening test for your like blood pressure, cholesterol, and
Mhm.
your A1C for your for diabetes. But in terms of diabetes symptoms, symptoms would be increased urination. People go during the night, they wake up a lot to go use the bathroom. During the day, they're just peeing all the time, being very thirsty, unexplained weight loss. If you've been trying to lose weight for years and you haven't, and all of a sudden you start to lose weight without doing anything different, you should go to your doctor to make sure something, bad isn't happening.
Okay.
Blurred vision is a common one. A lot of infections, especially urinary tract infections, and in women, like recurrent yeast infections can happen.
Mhm.
Some people have like tingling and numbness in their feet. That's when the diabetes is affecting the nerves in their feet.
Oh,
And
wow.
unfortunately, some people present with diabetes when they have a heart attack. So it kind of depends on how long you've been ignoring symptoms or
Mhm.
not realizing that you have symptoms.
Thank you so much. I'm sure that the audience is learning quite a bit here from you. So thank you so much, Dr. Wood. I greatly appreciate it. And then to end this has been a lot. We might have to do this another time because it's been a lot for me to digest, thinking about my health and family health that I always trying to think, oh, maybe those things are not real. But I remember one time, endocrinologist actually told me that she was asking me about my family history when I was
Mhm.
diagnosed with high blood pressure, and I also had a thyroid issue. And I was telling her about my parents, and well, not so my father, he's always been in really good health, no medical issues. My mom on the other side, she's had the high blood pressure and fighting to ignore the diabetes. I don't know if she come
Mhm.
to term with that as yet. But I was telling my doctor, and she's like, well, sweetheart, I gotta tell you, you don't have your father's genes.
Oh my goodness.
And I was like, because I had a pre-diabetes stuff going on too.
Mm.
But I was really, really scared. Having high blood pressure or having that diagnosis was scary, but that pre-diabetes thing, for years, I've gone up and down with that. So it really scares me. And I made some notes here, and I'll be talking to you a bit more because this education is really important and being really, really needed in our community. And like you said, in Barbados, there's a big issue with diabetes, even with young children. And
Mhm.
just to end, like, what would you advise our audience and anyone listening to either deal with diabetes or to avoid it altogether? And is it totally reversible?
Like I said earlier, make sure that you keep your regular appointments with your physician, with your doctor. Even if you're feeling well, still go for your annual physicals. A lot of people don't have symptoms, so they will pick it up on blood work. If you do have a diagnosis of prediabetes, you are in a perfect place to reverse, to get rid of that and to prevent yourself from going on to having diabetes. So reducing that weight, exercising, we stress about it a lot. Exercise and diet and losing weight. And you don't have to lose like 50 pounds. One big study looked at a medication called metformin
Okay.
that is used to treat diabetes and prediabetes. And they compared metformin to lifestyle. And in the lifestyle group, they lost 7% of their body weight. And what they found that was even superior than medication metformin to prevent diabetes.
Oh,
The
wow.
thing just think about 7% of your body weight. If you have prediabetes, that should be your goal.
Okay.
If you're 200 pounds, that's what, 16 pounds weight loss, something like that. Just losing weight, exercise, diet is a good way to prevent the progression of prediabetes to diabetes. If you do have a diagnosis of diabetes, you can get your diabetes into remission. We don't really talk about diabetes being reversible because once you have diabetes, you're always at risk for your blood sugars going up again. So we
Oh,
talk more about remission. Remission meaning your numbers are no longer in the diabetes range without being on medication.
okay.
So within the first 5 years, that's the best time to get remission of diabetes. More than 5 to 10 years, it's less likely to happen. But I have seen patients even get off of insulin by really making those lifestyle changes. Have a really good support system.
Yeah.
Diabetes is a really tough disease to manage. A lot of people get burnt out from checking their blood sugars and having to eat a certain way. People with diabetes have a lot of depression because it's just so overwhelming. So
Mhm.
make sure that you have a really strong support system to work with you.
Great advice. Thank you so much, Dr. Wood. It's been a great pleasure. The education, like I said, I'm sure it's going to be life-changing for some people. Really, really have opened up my mind to some things that I can also do to prevent diabetes. And for those in my family, we got work to do, friends. And I know you said you do consultation and blogs. Is there a way for us to follow you online?
Yeah, you can follow me on all social media handles at Dr. Kelly Wood, MD.
Dr. Kelly Wood, MD.
I'll
Okay.
spell that DrKellyWood, MD. Facebook, Instagram, you can find me there.
Awesome. Though that's really great. I'm also gonna add your information into the description so that the viewers can follow you for information because sometimes we don't like going to the doctors and we get that white coat syndrome. So it's really great to be able to follow someone that looks like you that we can identify with and trust. That has been a big issue for us in our community. So thank you so much. I'm so happy that you chose the study that you did because it's really needed. And you said you dealt with your grandfather, and that got you into this specialty of endocrinology. So thank you so much for choosing that. We needed education. We need you there as a physician and someone that we can relate to. Thank you for joining us on Living Passionately with Pat Brown, and hope to see you. And I will see you soon. Talk soon.
Thank you.
Okay.